Hey there, I'm Paul Muns from our microbiology class at CMU, and today I'm going to talk to you about why a burn victim is so vulnerable to infection. I'm sure you've all seen someone or known someone that has serious burns. Commonly, you do not think of the threat of infection and instead think of the pain or possible lifelong scarring. As I will discuss, however, the threat of infection is of the utmost importance when dealing with a burn victim. Without quick actions by doctors, a bad burn could quickly turn into a life-threatening infection. First, it is important to understand what happens during a burn. When a serious burn happens, the main physical barrier has been destroyed or reduced. Skin normally functions to provide a tough layer between our bodies and the environment. With oils and keratin, all the mechanisms work together to protect the body from microbial threats, keeping them from having a chance to enter the body. But burns can potentially kill many different types of body cells, leaving a nutritious feast for microorganisms. In addition to the destruction of the skin's mechanical integrity, the normal flora that colonize it is also removed. This normally outcompetes other bacteria, but without it, these foreign bacteria can colonize the body. Along with this, there's a generalized immune suppression after a burn, because your body is trying to fix the problems. So immediately after a burn, the surface is sterile for the first while. It becomes repopulated quickly though, by gram-positive organisms from the hair follicles, skin appendages, and the environment during the first 48 hours. More virulent gram-negative organisms replace the gram-positive organisms after 5 to 7 days. These have greater motility and have antibiotic resistances, and also the ability to secrete collagenases, proteases, lipases, elastases, and all kinds of things. This allows them to proliferate and enter into the subeschar space, which I will describe. Due to the mechanical disruption of the skin, environmental microbes are able to invade the deeper tissues. The usual skin barrier is replaced by a moist, protein-rich, avascular eschar that fosters microbial growth. The avascularity of this eschar prevents the migration of immune cells and restricts the distribution of antibiotics. This basically means that there's an unprotected layer of flesh with which the microbes can feast upon. Of these, the most important is Staphylococcus aureus and Pseudomonas aeruginosa. I could talk in depth about Staphylococcus aureus, however, it's late in the semester and there was already a lovely presentation on MRSA. It is important to note, however, that it is one of the most frequent causes of infection due to the pleasant environment that burn wounds present to this bacteria. Quickly, these gram-positive bacteria can colonize a victim and lead to delayed healing and the formation of abscesses. This delay can suppress the immune system. The Staph aureus can also extend into tissues, artificial devices, and the bloodstream and has been known to cause toxic shock. This does not bode well for the healing from a burn wound, especially with some types of Staphylococcus aureus being resistant to antibiotics and being extremely pathogenic. For more information on this, you can refer back to the presentation on MRSA. Another bacteria that threatens burn victims is Pseudomonas aeruginosa. It is an aerobic gram-negative rod with a single flagellum for motility. It can infect people in community-acquired places such as swimming pools or in your ear piercings or when people share needles. But this mostly causes a rash, but can be somewhat bad for people. It has a widespread presence in nature, so that's why it's around these community-acquired places. Some strains are unbelievably persistent to the environment and have been found growing anaerobically or in solutions such as distilled water. And they enter hospitals commonly on shoes, through flowers, produce, and all sorts of things. After entering the hospital, it can colonize the dead tissue of burn victims very quickly and can be very hard to treat. Pseudomonas is often characterized by coloring tissues green due to pigments the bacteria releases. This is also in the formation of green pus. In addition to this, it can invade the bloodstream, which can cause chills, fever, skin lesions, and septic shock. These symptoms can lead to tissue damage, prevented healing, and an increased risk of death. Together with these symptoms, this extremely virulent and abundant bacterium is understandably the leading cause of infection and death in burn wards. Some of the interesting abilities that Pseudomonas has is that it can stick to cells, can live on minimal food requirements, has a resistance to many antibiotics, and has a protective outer coating that kind of cloaks it from the immune system. And being all around the environment, it can be carried between patients and healthcare workers even if they don't show any symptoms. So it is easy to see how microorganisms, especially Pseudomonas, can colonize and infect burn victims. However, sometimes it's a challenge to determine when infections have begun. There are some clinical signs suggesting of burn wound infections, and they include if it progresses to other tissues, if there's changes in colors in the wound, or if there's extensive swelling in the wound. These are all telltale signs that an infection of the tissues, and it must be dealt with promptly to help the burn victim. But with that said, even people who seek medical attention for their burns will rarely develop infections. In the United States, only 4% of people seeking health care required hospitalization. And of these people who were hospitalized, only 10% of them died. And you have to realize that if they've been hospitalized with this, it's probably because the burn was very extensive and life-threatening. There are people, however, who are at risk for burn wound infections more often. Some of the factors include if the burn covers more than 30% of your total skin area, if it's a full thickness burn that goes to deeper tissues, if you are at the extremes of age, including children or elderly, or if you have a pre-existing disease such as immune suppression, diabetes, or asthma. That increases a risk for an individual, but other factors related to care facilities and outside forces include the virulence and antibiotic resistance of colonizing organisms, a failed skin graft, prolonged open burn wounds, or improper initial burn wound care. But with increased knowledge and better care, the recovery rate for serious burn victims has been on a constant rise. Some of the factors that have attributed to this lowered rate of infection and death have a lot to do with adaptations within hospitals. This includes better sanitation standards for doctors and nurses. Also, having separate wards for burn patients lowers victims' susceptibility to many microbes. But most importantly, quick and appropriate care of burn victims prevents many of the infections. Some common antibiotic practices are using topical creams such as silver sulfadiazine. Also, they commonly bathe burns with silver nitrate solutions. And for high-risk victims, a Pseudomonas vaccine can be used effectively to prevent infections. This vaccine uses immunized blood plasma that has both silver nitrate and a Pseudomonas vaccination given to victims, cutting the infection death rate from 32% to 9%. Together, these advances have cut the death totals from Pseudomonas bacteria by a substantial amount. In addition to this, better wound coverings have also helped victims by preventing fluid loss, which normally lowers resistances. This is used after dead flesh is carefully removed from the burns. Some wound coverings include a plastic, but more recently doctors have begun grafting a person's healthy skin to the burnt areas of the body. The skin is stretched up to 9 times its initial area, which facilitates the growth of new skin and lower scars. After the risk of infection has ended, there are also new ways of healing burned skin, such as applying lightweight plastic casts, which prevent the healed skin from contracting. This is significant in healing skin back onto victims more effectively, without needing a variety of cosmetic surgeries. Scars and crippling skin contractures have been reduced by this, and the risk of skin deformities is now much lower in people with extensive burns. Altogether, that sums up why a burn victim is so susceptible to infection, and what measures are taken to prevent this. In terms of small burns, you need not worry about infection. Instead of seeking medical attention, doctors assert that promptly immersing the burn in cold water is the best thing that you can do.